Really tired all the time.
Yeah, just everyday life, it's just a struggle.
It stops me from driving and working and focusing.
One night to be
Endometriosis is where the lining cells of the uterus, which normally form our monthly period each month, are growing outside of the uterus. And that can be anywhere from underneath the ovaries to down behind the back of the uterus, or in front on the bladder or on the bowel. And as a result of the cells growing in places where they shouldn't, they set up an inflammatory reaction which causes women pain and can cause other problems like infertility.
Lots of vomiting, goosebumps, temperature changes, sweats, and just lack of energy. But the pain is so sharp and horrendous, and that's literally month to month. There hasn't been an easy month for me. Every single month is absolutely agonising, so I at least have to have 1 to 2 days off work. It's completely debilitating, so it's very hard for me to get up because of the pain. It's all encompassing. There's absolutely nothing that will even touch the surface in terms of a painkiller.
When I was about 16, I had really unusual periods, like lasting 3 months, just a lot of pain, couldn't go to school. So I had that checked out, and I was told that I just had IBS, irritable bowel syndrome. So yeah, I suffered for a long time until I was about 21, when I actually found out that I had endometriosis. It's really hard, but you got to get through it.
Gradually the pain got worse and worse and worse as I got older and older, but I didn't recognise it as anything just from normal period pain. It's really hard to explain to someone that doesn't have it what the actual pain is, that it's like someone stabbing you in the stomach. I block out a lot of things, so I block out the pain, I block out the fact that I've been through 3 IVFs and all the challenges associated with that. I do a lot of denial. I just get on with things.
Australia is a not-for-profit. Our mission is focusing on awareness, education and funding research in Australia. Some women can be bedridden every day, all day, and their quality of life is just short. So my passion is to change it for the next generation of women coming through, so they don't have to go through what we went through to achieve a diagnosis and treatment. This organisation is so much bigger than me or anyone else in it. It's about the 583,000 women in Australia that have endometriosis.
both under influence.
There's still a lot of research needed into exactly looking into the cause of endometriosis, and hopefully by evaluating the causes a little bit better, we'll be able to then use different options for treatments for women as well. And so developing treatments requires funding and research as well. So there's certainly a lot to do. I think that by raising awareness and talking about these problems and trying to help people understand what it actually means and what's normal and not normal for women to experience, then we can sort of raise the profile of endometriosis, and I think that will definitely help in terms of awareness and funding and the ability to do more research in the area.
The message that I do want to send is for people that do have unusual periods, do feel a lot of pain, even if you're young, even if you're late, early teens, just check it out.
I think it's got to start with awareness and education. So I do believe that there needs to be some form of either in-school education or seminar that really introduces people to the word.
The only way that they can diagnose it is through doing surgery, and there needs to be another diagnostic tool that assists with that we don't have to go through these surgeries.
With Endometriosis Australia, our other role is part of education. So we want to educate women, to empower them to be able to make the right choices for themselves, and to be able to say, well, hey, this isn't okay, it's not right, and it's not normal, I need help.
Call for hands up.